आज का जो वेबिनार है ये टेडेक्स टेड सर्कल के द्वारा होस्ट किया गया है और ब्रांडसॉफ्ट इज ए होस्टिंग प्रोवाइडर फॉर दिस इवेंट। और इस इवेंट में हम लोग डॉक्टर मंगला कोहली जी को हमने इनवाइट किया है। उनका काफ़ी मेडिकल इंडस्ट्री में काफ़ी अच्छा कंट्रीब्यूशन है। उन्होंने मिनिस्ट्री लेवल में भी काफ़ी अच्छे अच्छे काम किए हैं। तो हम लोग जो ये इवेंट करने जा रहे हैं इसमें हम लोग कोरोना और कोरोना से रिलेटेड जो हेल्थ केयर प्रोफेशनल्स हैं और जो अलग और भी जो कोरोना वॉरियर्स हैं उनको कैसे प्रिवेंट किया जाए, उनको कैसे अच्छा एक इन्वायरमेंट दिया जाए ताकि वो भी बहुत अच्छे तरीके से आगे बढ़ सकें। और हम लोग ऑफिशियली इस इवेंट को अब स्टार्ट कर रहे हैं। सबसे पहले हम लोग डॉक्टर मंगला कोहली से उनके प्रोफेशन के बारे में थोड़ा सा इंट्रोडक्शन हम लोग करते हैं। फिर हम लोग हाउ टू प्रिवेंट फ्रॉम दिस कोरोना वायरस, सो उस पर हम लोग डिस्कस करेंगे। और लास्ट में हम लोग कुछ क्वेश्चंस डिस्कस करेंगे कि कैसे हेल्थ केयर वर्कर्स को हम लोग अच्छा कर सकते हैं। तो हमारे साथ मंगला कोहली हैं और हम उनका बहुत हार्टली कॉन्ग्रेचुलेशन करते हैं और उनको बहुत बहुत धन्यवाद देते हैं कि उन्होंने अपने कीमती समय हम लोग को दिया है। और बहुत ही हम लोग के लिए रिस्पेक्ट की बात है कि हमारे इस वेबिनार में डॉक्टर मंगला जी हैं। तो thank you for participating in this webinar. So, ma'am, can you introduce us for few details about your profession, your backgrounds, and all these things. So, over to you, Dr. Mangla Kohli.
Good afternoon, everyone. It's my privilege to be on this platform, and I'm really thankful to, I'm really very thankful to the TED circle who has given me this opportunity to speak on this platform. And as well as I'm thankful to Mr. Santosh Kumar ji, and all the IT team working for this group. And I'm very fortunate to be given a very good topic, which is really going on nowadays. So let me introduce, my topic is the challenges during the changing weather of COVID-19. So these things can be, the COVID-19's coronavirus symptoms can be, confused with other things also. So it is very important for everybody to know what are the things going on, what are the challenges during this changing weather. So everybody should know these things. Along with coronavirus, something else also can happen, right? Because this is a rainy season. So some places there are, of course, the water logging is there, and then there is the waterborne diseases, foodborne diseases, what all things are happening. So that I'm going to introduce maybe later on. Just let me introduce the coronavirus. What exactly the coronavirus is, which is the really concerned topic for everybody should know at least little bit of it. And that is a scientific reason behind it. I'm going to introduce it. Next. The coronavirus, in this introduction, you should know the coronavirus belongs to the coronavirus family. And this represents the crown-like spike. Okay, here you can see it is like a crown-like spike. All these crown-like spikes are represented. And this whole thing, the outermost layer is made up of the total protein, fat. Okay, so the coronavirus are the minute, the size of this coronavirus are the minute in size, that is in a nanometer, 65 to 125 nanometer, and it has a single standard RNA. The size ranging may range from the 26 to 32 kbs in length. The subgroup, there are subgroups of coronavirus families are there. That is alpha, beta, gamma, and delta. The virus reported to be a number of beta group named SARS coronavirus 2 or the COVID-19. Now let's see the comparative analysis emerging from the spreading of coronavirus. It started in the 2003 in China. The virus was confirmed as a member of the beta corona subgroup and was named as a SARS-CoV-2. COVID. The infected patient exhibited pneumonia symptoms with the diffuse injury, which leads to the acute respiratory distress syndrome. In the alveoli, what happened in the alveoli? Alveoli are the main thing where there is exchange of gases occur. And then when there is a diffuse injury to the alveoli, that will lead to the acute respiratory distress syndrome. The SARS initially emerges in the Guangdong, China, and then spread rapidly into the globally, and more than 8,000 people infected. That too, and there was a death, that is a 776 deaths were occurred. After a decade, that is in 2012, a couple of Saudi Arabian nationals were also infected with another coronavirus. In Saudi Arabia nationals, there are other people were also infected with another coronavirus. The WHO reported the MERS coronavirus infected more than 2428 individuals, and the death occur out of this is 838 deaths. Okay. Recently, by the end of 2019, WHO was informed by the Chinese government about the several cases of pneumonia, which are unfamiliar etiology from which is infected from the Wuhan. On 12th January 2020, the National Health Commission of released the further details about the epidemics that is suggested of the coronavirus, that is the viral pneumonia. And from the sequence-based analysis of isolated from the patients, the virus was infected as a novel coronavirus. 213 countries. This has totally infected 213 countries in all over the world are affected with the 208 lakhs 82,109 coronavirus positive cases. Out of this, 74 lakhs 7 lakhs 48,522 deaths occurs over the period of time. Human corona, human to human. This was human to human spreading due to the close contact with a person exposed to coughing, sneezing, and respiratory droplets and aerosols. So the spread of this coronavirus was human to human by coughing, sneezing, and the respiratory droplets and the aerosols. These aerosols can penetrate the human body via the lungs, through the nose, through the mouth, and also through the eyes. Conjunctival eyes. Okay. Here you can see in this slide, this is the primary reservoir. This is the coronavirus. This is the primary reservoir. Here they have shown seafood. Okay. Now the coronavirus, this is the bat, and it has impacted to the intraspecies transmission to the bat, rat, and some of the birds. And here also it's showing the different type of animals. They got infected, and then it got infected to the human. And once it came to human, then it infected the human to human. See, while eating and coughing, sneezing. In a study, the MERS coronavirus was also detected in the bats. However, after genomic similarity, findings of novel coronavirus supported that only bats could be the key reservoir. Okay, they have later on they have diagnosed that it was the only the bat was the key reservoir. Further analysis of homologous recombinations reveals that binding of the spike glycoproteins, novel coronavirus, which is developed in the SARS-CoV-2 and yet unknown as a beta COVID. Now here you can see the comparative analysis of SARS-CoV and SARS-CoV-2. SARS-CoV, which occurred in the 2002, there was this occurred and this occurred in December 19. SARS-CoV-2, which emerging date is 2002 November. Here is the 19th December. Then the Guangdong, China. Here it comes from the Wuhan. The date of fully control, it was fully controlled in 2003. So I think hardly some 8-9 months was there. And here is still is not controlled. Okay. Now the key host was from the bats, civets and some dogs. Here it's only from the bats. The number of countries impacted is 26 countries were impacted. Here is 213 countries impacted. Now the ACE2 receptors was entry receptor in the human, and here is a ACE2 receptor also entry receptor in the human. Now the signs and symptoms was almost similar, but there was some fever, malaise, headache, diarrhea, shivering, cough, soreness, or the breath. Here also the cough, fever, and soreness of breath. Then disease caused by the SARS ARDS, that is the acute respiratory distress syndrome. Here the ARDS COVID. The number of cases infected, here, number of total number of patients recovered. There is a total number of patients recovered. Now the key features and entry mechanism of human coronavirus was a receptor binding domain, RBD, which was loosely attached to, therefore the viruses may infect the multiple hosts. Okay. The other coronavirus mostly recognize the aminopeptides, carbohydrate, as a key receptor for entry to human cells. COVID and the MERS-CoV recognize the exopeptidase, the human airway trypsin like a protease, the cataptrypsin, membrane proteins, serines 2. So the human airways trypsin was the main how it is impacted to the human to human. Here it is showing the pathogenesis. The whole thing which is occurring into this electron microscopically, you can see this is the total structure, translations of the, this is the rough endoplasmic reticulum, Here is the nuclear membrane, replication of translocations here. This is the receptors, and here it is showing that is the exocytosis, the attachment and the entry of this by the endocytosis, there is the entry, and here is the exocytosis, the this COVID infected material is thrown out from the cell by the process of exocytosis. This is the Golgi complex. This is the rough endoplasmic reticulum. So this is showing the pathogenesis is showing in the electron microscopically in the cell. Now the genomic variation in the SARS coronavirus 2, there are 4 structural genes. which includes the spikes S, envelope E, membrane M, and the nucleocapsid N. Now, the recent studies have indicated the notable variation in the SARS-CoV-2 and the SARS-CoV-2, such as absence of 8A proteins and the fluctuations in the number of amino acids 8B and 3C proteins in the SARS-CoV-2. It is also reported that the spike glycoproteins of Wuhan coronavirus is modified via a homologous recombination. The spike glycoprotein of SARS-CoV-2 is the mixture of the bat, that is the SARS-CoV-2 and now beta-COVID-2. In the fluorescence study, it was confirmed that the SARS-CoV-2 also used the same ACE2 angiotensin converting enzyme 2 receptors. Okay. Beta coronavirus genome organized here. This is also the major obstacles in the research progress is the previously to examine the replication of SARS-CoV. Various animals models were used, which shows the symptoms of severe infection. In the contrast to the SARS-CoV, no marks was COVID patients pathogenesis was observed in the small animals due to the non-compatibility of the DPP-4, the receptors. Previously used animal models for the SARS-CoV-2 can be utilized to study the infections pathogenicity of SARS-CoV-2 as ACT receptors. The SARS-CoV-2 has been reported to replicate this cause severe disease in the rats, where the sequence analysis revealed the mutation in a spike glycoproteins. There is a spike genes which the mutation has occurred. Recently, the mice model and the clinical isolates were used to develop any therapeutic strategies against SARS-CoV-2 induce the COVID-19. The infection, interferons, nebulizations. There are some potential therapeutic strategies were used in this. Interferons, nebulizations, broad spectrum antibiotics, antiviral drugs, then some other antibiotics, antiviral drugs was also, you all know the chloroquine was also used, nitrazoid, nitrosonides, ribavirin, penciclovir, ritonavir, and some other drugs also. They were all used in this treatment of this. Next slide, please. In this study, it was identified that the monoclonal antibodies was also bind with the spikes RBD, SARS-CoV-2, and this is likely due to the antibodies in the epitope not overlapping, divergent ACT2 receptor binding modified. Coronavirus CR302 has the potential to be developed as a therapeutic alone in the combination with the other neutralizing antibodies. Prevention and the treatment of the COVID-19 infection is also next one. Next. There is no availability of vaccine against the coronavirus 19. Recombinant proteins from the urbani, then the DNA fragment inactivated, whole virus or the live vector virus, SARS-CoV-2 and the AY27874 was also used. This was a DNA fragment. Next slide. The mRNA, messenger RNA based vaccine prepared for the US national allergy with infectious disease against the SARS-CoV-2 is under trial. DNA 4800 based vaccine will be also soon available. mRNA is related with the nucleus. This is related with the protein, protoplasm. GeoVax, Biovax is also working on the developing modified vaccine, based vaccines. Next slide, please. The novel coronavirus originated from the human seafood market at the Wuhan, China, rapidly spread in 203 countries. DNA recombination found involved in the glycoproteins associated with the SARS-CoV-2. Another beta COVID could be reasons for the cross-species transmission and rapid infection. The zoonotic source of the SARS-CoV-2 was not confirmed. However, the sequence-based analysis suggested the bats as the key reservoir. Next slide. So, according to the pathogenic tree, the SARS-CoV is closer to the SARS-like COVID-2. Until now, no promising clinical treatment or a prevention strategies have been developed against the human coronavirus. It can be concluded that the homologous recombination events at the proteins of the RBD regions enhance the transmission ability to viruses. The rapid diagnosis kit on the or a meter for the detection of the SARS-CoV-2 in the suspect patient is required, as a PCR-based testing is expensive and time-consuming. Next slide. So please protect yourself. As you know, there is no treatment has already been still not possible. So please protect yourself. You should learn how to live with the coronavirus. We are still in the pandemic phase. The rise is still to occur. By the end of this month, September, the rise will keep going on. Then the straight curve will occur. So please try to protect yourself. Stay home until unless it is not essential. If it is very essential to go out, then only you leave the house. But when you leave the house, you must wear a mask. You must maintain the distance. At least 2-meter distance you must maintain, which is very, very essential. See, what is in our hand, we can do. What is in others' hand, they are doing it. Okay? So, it's better not to land up yourself in the problems. And when there is some comorbidity patients are at home, like patient with the cancer, patient with the diabetes, patient with the mental illness, patient, aged patients are at home. You have to be very careful. When you go home out from the home, when you come back, you must take bath. Don't go near them because nobody knows who is the carrier, who is infected, because infected patient cannot know it till 5 days. Till 5 days you have a fever, you will not know. Soon, between the 5 days, 4 to 5 days, you will start shedding your coronavirus. Before that, you will not know whether you are positive or not. So please try to stay away from the comorbid patient. The patient above 60, 65, you have to stay away from them. Patient with the cancer patient, hepatitis patient, diabetes patient, hypertension patient, heart patient, you have to stay away from them. Any accidental patient, you have to stay away from them. Any mental patient, you have to stay away from them. Okay, so it is very, very essential that you have to maintain the distance. You have to take care of yourself, and as well as you have to take care of the others. So please protect yourself. Stay away from the comorbid patient. Don't let everybody in the house. And don't shake hands with everyone.
Can I ask one question? Hello?
Yes, you can, sir.
Recently, we in the news there's a flash news by Russia. There is a vaccine is developed. Is that true or it is misleading? Something like that. Earlier, also we came to know pharma companies claiming they have made the medicine, but actually it is not accurate medicine for this disease.
See,
So please share
it
your
is
opinion, ma'am.
difficult to say. It is very, very difficult to say because the vaccine production cannot be so haphazardly done. Second, the clinical trial, until unless clinical trial on human is not done, they cannot bring the vaccine, they cannot launch the vaccine in the market. Do you understand?
Ma'am, how much time it's normally take for clinical
It
testing
takes
for
minimum
6 months?
2 years, 2 to 3 years.
Right, ma'am. Now its vision is more clear, ma'am. Thanks for that.
See, I am not the competent person to tell because I am not in that. It is not my domain. But what my experience I can give you that it takes minimum 2 to 3 years because maximum clinical trial, whatever we will do, it takes of course time.
Right, ma'am.
And second thing, the rapid test which are doing it, that is also not very foolproof. Not very foolproof. You can see, you must have seen it.
Right,
It's
ma'am.
not very foolproof.
Right, ma'am.
तो अभी भी ये देखा जा रहा है कि जो जैसे झारखंड हुआ, वेस्ट बंगाल हुआ, सारे जगह जो स्टेट लेवल के जो रिप्रेजेंटेटिव हैं वो अपने लोकल इशू में ही ज़्यादा इन्वॉल्व हैं। वो कोई भी कोरोना से रिलेटेड मुझे नहीं लगता है कि कोई एक्टिविटीज़ या प्रिकॉशंस की बातें कर रहे हैं। तो कैन यू सजेस्ट मी कि मतलब कैसे हम लोग इस लॉकडाउन पीरियड को, इस पीरियड को हम लोग इजली वे में हैंडल करें, क्योंकि स्टेट गवर्नमेंट से मुझे नहीं लगता है कि ये चीज़ें कंट्रोल हो रही हैं और ये सिर्फ टाइम पास हो रहा है। तो कैन यू गाइड अस कि
देखो पेरीफेरी में तो हार्डली एनी इंफ्रास्ट्रक्चर इज अवेलेबल. Everything is totally concentrating to the metro cities. All infrastructure, healthcare equipments, everything is concentrating to the metro cities. Second thing, the air travel where it has occurred, maximum patients are there. Okay? Air travel, wherever it is air travel, maximum patients are there. But still, the migration when they have gone from this Delhi and Calcutta and Mumbai to their villages, they have definitely spread the infection. But they can have the quarantine and get them the all right. Only one thing is there. Taki rest, it is difficult to say that there is any kind of infrastructure is there or anything.
नेक्स्ट थिंग है मैम, सभी जगह जो बातें हो रही हैं वो एक जनरल पब्लिक को लेकर के गाइडलाइंस जारी किया जा रहा है, लेकिन हेल्थ प्रोफेशनल्स को जो ज़्यादा इस चीज़ से ज़्यादा अफेक्टेड हो रहे हैं उनको किस तरह के प्रिकॉशंस लेने चाहिए, क्योंकि वो अभी नॉर्मल हैबिट में वो लोग वर्क नहीं कर रहे हैं। मैक्सिमम लोग जो है पीपी किट लगाए हुए हैं और बहुत से अदर ऑप्शंस भी यूज़ कर रहे हैं जो कि नॉर्मल डेज में वो नहीं करते थे। तो आप कुछ सजेस्ट करेंगे कि जो हमारे हेल्थ प्रोफेशनल्स हैं उनको किस तरह का केयर करना चाहिए, किस तरह के प्रिकॉशंस लेने चाहिए, चाहे वो घर की बात हो चाहे ऑफिस की बात हो। तो कैन यू गाइड अस?
प्रिकॉशन किस तरह के? डॉक्टर्स के लिए?
हाँ जी, हेल्थ प्रोफेशनल्स जो हैं।
See, the doctors are been put in the round the clock. They have made the different batches. Doctors and healthcares are been made in a different batches. Okay. And they have been put up on duties on the batches wise.
Okay.
And after the duty, they go to the quarantine home where they have to stay there. They can't go home.
Okay.
Okay, they can't go home and meet their families because their families are also to the state exposure. Is that's why they should not be going home. And when they finish their duties, maybe after a week, they complete their duties. They have to stay there for 7 days more. And after completing the quarantine period, 7 to 10 days, they can go home. Then next batch comes. So in that case, we require a lot of doctors also.
मैम एक मैं काफ़ी न्यूज़ और इस चीज़ में काफ़ी रिसर्च कर रहा हूँ तो देख रहा हूँ कि बहुत सारे कोरोना सेंटर तो बने हुए हैं लेकिन वहाँ पर पेशेंट जा नहीं रहे हैं सबको होम क्वारंटाइन किया जा रहा है तो
It's better to stay home because the rapid test is also coming up, is not reliable. Rapid test is also not reliable. So it's better to stay home and protect yourself, wash yourself, wash your hands at least 5 to 6 times a day. Don't touch any knobs, don't go out, and you have to be very careful and eat immunity drink karo, and then eat good nourishes food. That's all.
Santosh sir, one more question.
Yeah, please.
If you please allow. Santosh sir, should we avoid using Ola and Uber because these are shared cabs because people usually sit in that and after then another person sit in that. So should we avoid this Ola and Uber for transportation? Please advise, ma'am. Please advise.
Soda.
Ma'am, Ola and Uber taxis.
Ola, cold drinks.
No, ma'am. Ola and Uber, ma'am. Taxis, cabs, ma'am.
See, there is a lot of. I also used once or twice Uber, Ola.
Yes, ma'am.
There is a lot of decrease in there is economy very badly. They are not able to take out their installments also for the car. They have invested money in the car and they are not able to pay the installment. Government is also announcing lot of things, but I don't know how the things are reaching to them. That also it is difficult. So what they have done, you can use Ola, Uber, and they have done the plastic. They have kept, they have surrounded with the plastic. They made a one plastic jacket surrounding their seat. So I find there is no problem going by Ola, Uber.
Next question is home care tips. Can you guide me some home care tips?
What?
Home care tips.
Home care tips. In the home care, you have to keep each and every corner of your house very clean, which is very, very important. Cleanliness is important. There should not be waterlogging anywhere. There should not be any कूड़ा वगैरह कहीं पर नहीं होना चाहिए. एंड डस्टिंग वगैरह बढ़िया अच्छे से होनी चाहिए. मच्छर नहीं होने चाहिए घर के अंदर आसपास. कोई वाटर बॉडी घर के अंदर नहीं रखनी चाहिए बिकॉज डेंगू का मच्छर साफ पानी में होता है. फैलसीपैरम मलेरिया साफ पानी में होता है. ओके, सो पानी भर के कोई मनी प्लांट वगैरह रखते हैं वो नहीं रखना चाहिए. एंड जब घर में सफाई बिल्कुल जरूर होनी चाहिए. यू हैव टू कीप वॉशिंग योर हैंड्स मेनी मोर टाइम्स. You have to keep using your sanitizer also. And if you get something from outside, you have to sanitize. And if you get the fruits from outside, you have to wash the fruits with the soda bicarb. You have to wash the vegetables also with the soda bicarb and salt, and then use it. So everything should be washed or leave it outside for 4-5 hours. So it will get out. The coronavirus will go out there.
So I think today we discussed a lot on different topics, and thank you for guiding us in proper manner. और काफ़ी knowledgeable ये सेशन रहा. स्पेशली फॉर यू, मैंने आपके बारे में सुना भी है कि आप लोगों को आउट ऑफ द वे भी जाके लोगों को हेल्प करते हैं। तो ये सुन करके दिल से एक दुआ आपके लिए है मैम कि थैंक यू। आप इसी तरह से हम लोग को गाइड करते रहें, इसी तरह से देश सेवा करते रहें। कुछ चीज़ें जैसे गवर्नमेंट में आपने कुछ काफ़ी अच्छे अच्छे काम किए, तो कैन यू ब्रीफ मी लिटिल अबाउट आपने गवर्नमेंट में किस किस तरह के इनिशिएटिव किए हैं?
What you said?
आपने गवर्नमेंट में किस तरह के इनिशिएटिव लाए हैं, किस किस तरह के चेंजेस आपने किए हैं?
अच्छा, हाँ, मैं लेडी हार्डिंग में थी पहले। आई एम ए स्टूडेंट फ्रॉम लेडी हार्डिंग मेडिकल कॉलेज
ओके मैम।
एंड MS ऑल्सो वहीं से किया है। और फिर मैंने प्रैक्टिस की है 13 साल, जनरल प्रैक्टिस की है। काफी काफी पेशेंट देखे हैं, काफी अच्छे से काम किया प्रैक्टिस में भी। और फिर ज्वाइन किया जॉब, तो लेडी हार्डिंग में ज्वाइन किया। फिर मिनिस्ट्री गई मैं। मिनिस्ट्री में 2007 से 2014-15 तक, 15-16 तक मैंने काम किया। और मेडिकल एजुकेशन का काफी काम किया, पैरामेडिक्स का काम किया, नर्सिंग एजुकेशन का काम किया एंड मेडिकल एजुकेशन का काम किया। उसमें PG सीटें बढ़ाई, अंडर ग्रेजुएट सीटें बढ़ाई और MBBS करिकुलम के ऊपर बहुत काम किया। और ये जो नेशनल एलिजिबिलिटी टेस्ट है, ये मेरा क्रिएशन है, माय टोटल माय विजन एंड माय क्रिएशन। और इसको एग्जीक्यूट किया। तो ऐसे तो काफी काम करते रहते हैं। अब काफी ऑर्गन डोनेशन में काफी काम कर रही हूँ मैं।
हाँ, आपके बारे में मैंने ऑर्गन
डायलॉग विद
डोनेशन के
ऑर्गन्स है, जिसमें मैं बताना चाहूंगी कि आप स्मोक मत करिए, आप ड्रिंक मत करिए, आप जंक फूड मत खाइए और कीप योर लीवर हेल्दी एंड हैप्पी। सो एटलीस्ट यू विल नॉट हैव एनी प्रॉब्लम जिससे तकलीफ हो। सही है। तो ये काफी मैंने काफी किया है सफदरजंग में आने के बाद में। तो बस चल रहा है अपना काम, तो अभी बंद थोड़ी ना, चल ही रहा है। ठीक है,
ठीक है मैम। फॉर थैंक यू फ्रॉम ऑल माय
thank you
टीम।
so much, thank you to all of you, and thank you to the platform who has given me this opportunity to speak. And I'm really grateful, and nice, बहुत अच्छा लगा आप लोगों से बात करके। ठीक है,
जी मैम, थैंक यू। और जितने भी पार्टिसिपेंट हैं उनको भी बहुत
and thank
थैंक
you
यू कि
all the
उन्होंने
participants, thank you everybody।